Welcome to Rubin On Point, a podcast about cancer, resilience, and being human. I'm Dr. Dan Rubin, and together we'll uncover the true power of resilience, the strength to recover, adapt, and thrive through life's toughest challenges. Each episode will bring bold ideas, transformative practices, and inspiring stories that redefine what health, healing, and what the human spirit can achieve. And you're going to meet some really cool people along the way. If you're ready to turn obstacles into opportunities and live with greater purpose and courage, you're in the right place. Let's get started. Your journey to resilience begins now. Welcome again, everybody, to Rubin On Point. Today is another patient perspectives episode. I know we haven't dropped one in quite a while, but this one is really, really special. As you know, Rubin On Point is a podcast about cancer. It's about resilience. And again, most of all, it's about being human in this world. Today, we get the opportunity to talk to one of my patients, Miss Micalyn McCready. And we've had a doctor-patient relationship, I'm thinking 5 years now.
Almost six.
It's
Funny, yeah.
I remember looking back. Well, first of all, welcome. Thank you for being here.
Thanks for having me.
Yeah, of course. Well, yes. I mean, we've been planning this for a while, and it's ripened to the point where it's even extra special because we have goodies to share, like modern goodies. What's the date? April 29th today, 2026. And we have extra special goodies because right now you are cancer-free.
That's right.
It's a big deal.
That is a big deal.
And for everybody listening, like, it's not just a big deal. It's like if B and I and G were the size of this office, that's how big the deal is. And not just because I've been in this oncology world for 30 years and have seen patients and know how the pace of things go. And not just because you have been through enormous amounts of diagnoses outside of just, the cancer. We should talk about that. Yeah, hospitalizations, sure. Things where you have just moved through them, but also because I know some of the molecular underpinnings of the tumor and the things that are like, okay, well, that presents a challenge. And you are one of the people who made a decision that you were just going to be okay.
Yeah, absolutely. And I appreciate you saying that.
Yeah, well, of course. That's what I think. So what type of cancer did you have?
So I had squamous cell tongue cancer.
Tongue cancer, which is why you can't pronounce certain words.
I have the best lisp ever.
Yes, you do. You do. You were operated on your tongue.
Right.
Yeah. So when was that? Tell us about that. Tell us about your story. I mean, this is such an incredible story, and it's so juicy and scintillating. I want to sit back and kind of listen, too.
Sure.
Yeah.
So it was September of 2019. That I had, it was September of 2019, I had like a cut on my tongue, but I also had Invisalign. So I was like, it's not that big a deal. Yeah. It's fine. It's an irritation from my retainer. And,
how long had you had Invisalign by that time? Was it brand new?
No, it wasn't brand new.
Okay.
So I had it for a while, and this was like the final retainer.
Oh, so it was like a new one that you put on, like it was squeezing?
No, not at all.
No, but all right, whatever. So
I don't even remember what happened.
Yeah, okay.
I had it a couple of months and ended up with this irritation on my tongue, and it was a cut.
Okay.
And so I called the dentist, called the orthodontist, and they're like, oh, yeah, that'll heal up is from that.
Like they took a look at it? Or
they looked at it, yeah. And so after that, I had like every cream on the planet. Yeah. I had all the paste, all the cream, all the washes, everything to try and do that deal.
Was it getting worse?
Yeah. It was getting worse. But my whole story is I was always told that I was fine because I was healthy. And so they're like, oh, you're fine. Oh, you're healthy. You're fine. Don't worry about that. And so when that happened, it wasn't healing up. I had been through a couple of months and had gone on vacation right before COVID hit. So that would have been September, and then now we're in January.
That COVID creeps into people's stories all the time.
All the time.
Yeah.
So went on vacation, came back,
Where'd
and I
you
was
go?
in Costa Rica.
Okay.
My favorite place.
Yeah.
But we had, I don't know, I called the oral surgeon and I was like, hey, this is not healing. And
That's scary.
yeah.
That's like a realization, like this isn't just a cut.
Mm-hmm.
Yeah.
Oh, it was not. It was an ulcer
Yeah.
by that time. So then I went in and he said, well, if it doesn't heal up in 2 weeks, call me back. And by then, I'm starting to worry a little bit. I had.
Oh, so you get another new 2 week, like if it doesn't heal, like why
Right.
would it heal up if it just has only gotten worse? Was it treated? Did he do
No.
anything different? He just said, okay.
At that point, they said, well, if it doesn't heal in 2 weeks, it was another cream.
Yeah.
There was always one more thing to try.
Right.
Another antibiotic, another this, another that. And he said, okay, 2 more weeks. Then I've been into a laser surgery to try and get it to heal. Well, by that time, it had split open. Oh, yeah. And the side of my tongue literally split open. And
Like that, which was way more painful.
oh, yeah. It was horrifying.
Were you starting to lose sleep?
Oh, yeah.
Okay.
For
Like
sure.
because of the pain or because of the mental aspect?
All of it.
Okay.
I was a complete disaster.
Yeah.
And so.
And things were going crazy because I remember
Mm-hmm.
talking to you about your job, which we should probably, could we segue into that? You were the CEO of a company at this time. And
I
I'm
was.
imagining that you were in lots of meetings and especially around COVID. It's like, okay, what are we going
Right.
to do here? And based on the work that you do, which we'd love to hear about,
Mm-hmm.
it was probably hard to talk and this was on your mind. Take us through that.
For sure. It was, it was always like, oh, sorry, I have to take a break because my tongue is so sore. But who would have thought that I had tongue cancer, right? So I went back to the oral surgeon. He did another procedure. And then he said, well, while I'm in there, I'm going to biopsy it. And sure enough, it came back positive. But they were all surprised. And it came back as,
Were you surprised?
yeah.
Okay. Well, I didn't know if that started going through your head after months of non-healing. If you were like, well, maybe
Well,
this is
By that point, it was before ChatGPT, and before, but I
Fair
had Dr. Hoovel,
right.
and Dr. Hoovel was like, "Hey, if you have like a tingling in the tip of your tongue, then that's probably cancer." And I was like, "No."
Right. Like a tingle? My tongue tingles from time to time. Like I don't
Right.
have, why would I have cancer?
Why would I have that?
Yeah,
But sure enough, it was.
you did.
And so I called. I went to the oral surgeon on, I think, Tuesday. By Friday, I had an appointment at Ohio State.
But even though we're here in Scottsdale, Arizona together, you do and have lived in West Virginia.
Right.
Okay, but you got your medical care in Ohio.
Right.
Okay.
So it's about a 2-hour drive to OSU
Okay.
from where I live. And so the surgeon that I met with happened to have an opening on Friday.
Wow.
And so that was 4 days. And at that moment, he was like, okay, that was, I would say, mid-April. So kind of the thick of it.
Yeah,
and
right in the
COVID.
thick of it.
And he said, all right, I'm going to do surgery on you on Tuesday. So I was like, okay, sure, no problem. I had no time to think about it or prepare either myself or my job or whatever. And it was a little bit quick. But it was okay. I was like, okay.
But you were a CEO. You were used to things moving quickly and probably making decisions and moving on.
Sure.
Yeah.
Absolutely. You make a decision. You say, okay, this is what it is. I'm gonna do it. I'm gonna move on.
How did that conversation change your life?
I didn't know what it would do. Because they're like, hey, we're gonna and I have to give the surgeon props, and more so, as a patient, I couldn't ask for more. And
Yeah.
they said, okay, I'm going to replace half your tongue with your arm. I'm like, oh, cool.
Wow.
I'm going to have an arm tongue.
Yeah. An arm tongue.
And I had no choice but other than to accept it and deal with it and move on.
Well, you had another choice.
Well, in my mind, I had no choice.
Got it. What's it like to have an arm tongue?
It's not that great.
Okay.
Kind of cool because I can't feel the right half of my tongue. But
Well, there's a lot of your brain having to get used to that. One, just the notion of having that tissue in your mouth, on your tongue, which is one of the most neurologically innervated and sensitive areas of our body, and to have a different body part there. And then your body being able to sense the energy of that. But then also, like, your brain has to rewire itself. Thank God for neuroplasticity, I say.
definitely.
Yeah.
So after that, I was like, oh, I have an arm tongue. And this is really uncomfortable. Because when you have surgery on your head, everything swells. So it was about 3 days after surgery. And so at OSU, I think I was the first person after COVID to have a trach.
Wow.
They had shut everything down for a
Okay.
while, no surgery, nothing. So in this whole story, I consider myself very fortunate. Honestly.
Fortunate because you were able to get in early enough, even though this kind of dragged on, the cut. That's good to see the good in that. Yeah. I mean, you could have went the other way. You could have become depressed and been like, woe was me. Why do I have this? Why couldn't I get in? Why do I have to have this surgery? But you are not like that.
No,
No.
you have to.
And that plays a
do
huge
it.
role in healing and the decision to be well. Yeah.
Yep.
Okay, so having an arm tongue, because there's other people maybe watching this who are like, you know what, I have an arm tongue too. And you're right, it's actually not that great.
It's not that cool.
It's not that cool.
No.
No.
Some people have a leg tongue, and have an arm tongue. But, it is what it is.
And so do you have trouble? I mean, obviously, your words don't come out the way they used to before your surgery.
I was at one time the voiceover for our YouTube videos at work.
Wow.
Yeah, so I had this projecting voice, and now I'm like,
Yeah.
now I have a lisp.
Yeah, you have the iatrogenic lisp. Do you have any trouble saying certain words that are problems that
My
really
last
bug
name.
you?
My first name, it has gotten better. My last name, I went back to speech therapy for 6 months because I got remarried. So a wonderful man who has a very difficult to say last name,
What is it?
McCready.
And so does that trigger you that you can't say your name? Or
No, I think it's hilarious.
it's more fun. And
more fun.
I'm sure you guys have fun with that. And you're thinking,
do.
like, when you met him, you're like, why does your name have to be McCready?
Exactly.
Yeah. That's an obstacle to overcome, but you're having fun with it. And you're looking at it and being like, okay, this is my life. And this is what I have to do. So after surgery, you had further treatment. And this was back in 2020.
Back in 2020. So I had a couple of really close friends who said, hey, we have to call Dr. Rubin. And ended up calling you. And at the time, I had a spot show up on my lung.
And you're what?
Lung.
Okay. I just wanted you to say it again.
Thanks so
you're
much for that. We play a game
Yep.
called What I Said versus What You Heard.
Oh my God. Yes. Okay. We could play that game intermittently.
game.
Okay.
And so I had that show up. It was September of 2020. So I went through surgery, 37 radiation treatments to my head.
Wow.
Yeah, that was not fun. And then
Not just to your head, but to your mucous membrane area. How painful was that?
oh, that was awful.
I mean, I was along for the ride there, but
I think I blacked out from it.
Yeah.
I just don't remember.
I don't recall. Did you get a feeding tube?
No.
Okay, that's phenomenal.
I refused. I was like,
Yeah.
no, I'm not doing that.
Right, because you know how to make decisions and stick by them. And when you make your decision to be well, this was another one of them. I'm not going to get a feeding tube. And that is a road that some people choose not to go down, and they usually come up happy for it. There are people who just absolutely need it. You didn't. We got you through it.
Yeah. Got me through it.
It's huge.
And I think, with that, I had friends, I had family, I had physicians, I had all the support system that I could have asked for.
Yeah.
And so after that, we were moving on, but then the spot shows up on my first surveillance scan.
And okay, and what did you think? Do you remember the feeling you got or the thoughts you had when you either read it yourself or your doctor said, and there's a spot on
Right.
your lung?
It was, you know how you get hot and cold all at once?
Okay, that one we're going to have to play the game. I heard that was a hot coal all at once.
It gets hot and cold all at once.
You felt that way. Got it.
Yeah.
Stunned.
Stunned.
When you think back to that day, when I'm sort of pulling that out of you now, are you triggered?
No, I've been through a lot of therapy.
Yeah. And that helps.
It does.
Okay.
It's absolutely necessary.
It's perfect. When did you hear about that news? Because this is really a big deal. You've been through all of this and just the months of the tongue cut and one more cream and one more this and it's not this and you're fine. And now somebody says, there's a spot on your lung.
Let's watch it.
Exactly. Which means, here we go again. Yeah.
Here we go again. So then it was that was another September. That was about a year after my first spot on my tongue appeared. And I was like, oh, here we go. So it was then in January that I had a PET and a bronch and all of that.
Did you say a bronch? Yep. Explain what a bronch is.
So when they go down your throat and take a sample.
From your lung. When did you hear the results? How long did it take because that's a biopsy sample. Basically, they're taking a washing to see if there's cancer cells floating around.
Right.
And now you hear that it's positive, and then some sort of systemic treatment needs to be given.
So we went, it was recommended to go the immunotherapy route first and try it. So did that, and I was all along just fine.
If I remember, you had one of the longest runs of immunotherapy at OSU. Okay, so they say, let's try immunotherapy. It's less toxic. And these are back then still kind of new, and still doctors are getting used to it and how this works. And I remember you had a TP53 mutation at, correct me if I'm wrong, I think it was like 53.8% was what's called the VAF, which means it was prevalent. That is a big number, and that presents a problem. It's a common mutation to see, but I remember seeing that and being like, okay, and talking about it with you, and me thinking, okay, this makes things more tough, which is maybe where the issues with immunotherapy came in. What happened with immunotherapy?
I did fine. I went really...
We co-treated.
Yeah. COVID did fine, but what I had was too aggressive. It was...
What you had is what?
It was too aggressive.
Okay.
So it was in my hip, as well as my lung. And
that was what was shown on that PET scan. Yep.
And I said, well, we're going to try it.
So are you now in your head thinking back to, if I would have just gotten that cut dealt with earlier, because a lot of
1,000%.
Yeah. So you had to therapy that out of or become okay with that. That was the course of your life. That's a tough one.
So I had to kind of make myself and put myself in the mindset of, okay, maybe I wasn't as diligent or persistent with that, but now I'm going to be diligent and persistent with everything.
So that's a learning thing. And some people are like, well, I hired these medical professionals to know what the heck is going on. And especially when somebody's like, here, try another cream or the next antibiotic or something. But you are now looking at it as, you know what, I have to advocate for myself, and this was a huge learning curve. How do you feel about that and how you were treated medically?
I think at the time they knew as much as they knew. And that's really when we merged treatment types.
When you merged treatment types? Okay.
And decided to go down both paths aggressively.
Meaning chemotherapy and biological
Right.
therapy. Okay. And you did that for quite a while. And then you stopped the chemotherapy and continued the biological.
We went to Erbitux.
Erbitux, which is biological, not a
Right.
chemotherapeutic agent.
Yeah.
Yeah. Erbitux is a targeted treatment. It's a pretty old one too. It's one one of the older ones, and it worked well for you.
Yeah. So I did Erbitux plus chemotherapy for 2 years.
Yep.
And then Erbitux monotherapy for almost 2 years after that.
Yeah, that is a long time.
It was a long time.
That's you being a patient. You've had some ups and downs. You've had other sites of cancer show up. You've had sepsis. You've been in the hospital. You've had multiple infections. You've had other procedures done. Your story of resilience is just incredible. And I think we need to cover some of that for the audience to see just how deep this goes, to see what is possible because you're so well right now. You look fabulous.
Thanks.
You feel
Fabulous.
do you feel better than you did thinking back, even though you're almost 6 years older? Chronologically speaking. Biologically is a whole different story, but chronologically.
I think mentally, I'm a much more well individual in so many ways.
And name a couple.
So I went through this whole process of my entire life with a coach and walking along that with me, and went through my whole process and said, let's look at your friends. Let's look at all your relationships. Let's look at what you do. And it either gets cut out or it stays.
Okay. So there was no in between?
No.
What were some of the criteria for friends, whether they stayed or went?
If they supported or not.
How did you determine if they supported?
If they were there.
If they were there.
Showed up.
It's like the relationships are challenged, and at the time of the challenge is when you really see who's there for you.
Oh.
What about if somebody just threw you a text like, hey, I heard about it, how you doing? And then 3 months later just went to check in on you. Is that being there?
But, yes and no. So I think friends appear on different levels, right? So I think it's okay to do that. I think it's nice. Right?
But do those people stay?
I think they stay, yeah. But on a different realm of that circle. So I think you have your inner tight circle and the people who really show up.
There could be 2 or 3 of them, and that's it. Yeah.
I had like 10.
That's huge.
It was huge.
Wow.
And
The
then,
weight, if you put those 10 people on a scale compared to all the other people that were considered friends, those 10 people, I think, are going to tip the scale with the weight and gravity of what they did for you versus maybe 100 people over here.
Absolutely.
Yeah.
And it's still okay. Not if you shrink that inner circle. The problem was I had so many friends. Right?
Yeah.
And some of them I moved to a different circle, and that was okay. And
Wait, but so you had various circles of stay. Okay.
but some of them that were started on that outer edge dropped off
Went off the cliff.
the cliff.
Did they try and come back in?
Sure.
Okay. And how did you handle that?
I was like,
You what?
thanks.
You said what?
Thank you.
Thank you. And then just sort of let it fizzle out. So you weren't saying you didn't say I can't be friends with you. Was it like a text or a call or a drop by, or what was they're trying to come back in? What was their attempt like?
I think the attempt was to come back into that close circle that I already had.
You knew who it was.
Oh yeah.
Okay, so that's one thing that your therapist or your coach, you said,
Coach,
helped you with. Let's look at your friends. What's something else you looked at?
What I did, like the activities I enjoy and how I enjoy them.
So you had cut scores for those?
Yeah.
What
If
did
it didn't serve me, it went away.
What's an activity you did that did not serve you, if you can remember?
That did not serve me.
Frivolously scrolling through the channels or doom scrolling? Was it
No,
something
I
like
still
that?
like that.
Or was it like tennis and you're like, I never feel good after tennis? Like,
No, I love tennis.
okay. I don't know why I
I'm
picked
just
tennis.
back to tennis.
Yeah.
I think activities like invitations, groups, parties. If I didn't want to go, I just don't go.
Were you somebody that before this you felt like you had to do it all? Yeah.
Yeah.
Why? This is something I think a lot of people struggle with, is you feel like you have to do it all, and maybe you did have a lot of friends, but maybe
Yeah.
not. So I'm curious why.
I think that expectation that you put on yourself as well as other people put on you. What I didn't know and didn't realize was, okay, I'm in charge of this whole thing, this is my life, and if I don't like it, I am under no obligation to do it.
Yeah. And that felt freeing to you?
Oh yeah, that's right.
Did you ever think about that before your coach?
No,
So it was not a possibility,
it was impossible.
but a beautiful realization. Well, that's wonderful. What are some of the things that really, truly just stayed in your life and you held on to and were just foundationally stable? Your friends.
I think my friends, for one.
Yeah.
Activity-wise, it took a while to really find myself. Of, okay, well, what if I don't like to read?
To read?
Yeah, I really hate that.
Do you like to read?
And no, I'm not a book person.
Yeah.
And people are like, oh my gosh.
Wait, are you an article person?
Yeah, I'm definitely an article person.
Yeah.
But I realized I love to write. So it kind of turned the table on that.
Interesting. I didn't know that about you. What have you been writing?
So I'm in the process of writing a book.
I love it. Well, maybe when you're back in Arizona and the book is out, we can talk about it.
Oh, we'll have a solo party.
Yeah, I'm not even going to ask you what it's about because I can't wait to be surprised.
I will send you the first 6 chapters.
Oh my God.
See what you think.
Thank you. I can't wait. So you're working with your coach and you're on 2 years of chemotherapy and then 3 more years of Erbitox. What happened with your brain?
So when I stopped chemotherapy, this would have been about 3 years into the whole thing. So I was cancer-free with
Scan-wise.
right, scan-wise, cancer-free. And then, so based on that, we stopped the chemotherapy and remained on the Erbitox. Problem was, chemotherapy had kind of probably suppressed an original brain tumor that they believe now was there from day one. So
From before the tongue surgery.
probably.
But no-
Or as a result, and maybe they don't know when that came about,
Right.
but it either came about before the tongue or
But it didn't manifest
At the
before the
time.
tongue. And you didn't have chemotherapy until a while after your surgery. So nothing was there to suppress it unless your innate immune system somehow was acting in the brain, but not anywhere else, like in your lung or your bone. And so then what?
then I was at a friend's house, Christmas Eve, and the lead up to that is absolutely insane. We had scheduled time to exchange presents. And we had rescheduled that time about 3 times.
And so now it falls on Christmas Eve.
Now it falls on Christmas Eve. And we exchanged gifts. And I'm like, I don't feel that well. And on the way to her house, I had a nosebleed.
You were driving?
And so I was like, hey, my nose has been bleeding. Um, I don't feel well. I'm going to have a seat on the couch. So we're on the couch, and I stood up to say that I was going to go home. And I realized I couldn't talk.
I remember this.
Yeah. And at that point, her husband is a physician. And he went back in the house for one more thing before he left.
Oh, got it. Okay.
So he had his hands on the door and he said, I'm going to go to the bathroom. And by the time he got out of the bathroom, I stood up and couldn't talk.
I don't know about you, but I certainly feel that inside me. I don't know about anybody listening, but this is scintillating because your life has so much meaning, and you think about thrice you rescheduled this, and here you are now, because who knows where you would have been on this Christmas Eve.
I could have been driving.
Yep.
Traveling.
In a not well-known place. You could have fallen down.
Absolutely. But I was at her home, and but I was fully aware of what was happening. And she stood up, called her, yelled at her husband, don't leave. I pointed at him, like in a frantic fit of, we can't leave right now.
Yeah.
And he's like, do you want me to call an ambulance? And I shook my head no, because based on where they lived, I knew it would take too long.
You wanted him to take you.
Yeah. So he was honestly saved my life. I owe him big time. And
why do you owe him? Why do you feel that way?
Because he knew what to do and had the means to make the right phone calls.
Do you think he feels like you owe him?
No, of course not.
But you feel like you do.
Sure.
Would you do that for somebody?
Sure.
And feel like they owed you?
No.
That's one for the coach, right?
That's one for the coach.
What do you mean he knew what like he called the emergency department and said, we're incoming?
Incoming.
Okay.
This is what's going on.
Okay.
He had full story of what happened, and knew the medical terms to say and how to prep for that before I arrived.
I hear you. What happened in your brain?
So I had 2 brain tumors stacked on top of each other.
It's terrifying.
Oh, well, yeah. In my parietal lobe, which is why I couldn't talk.
Got it. And then what?
And then what was, I had a seizure in the ER within minutes of arrival.
I mean, the timing on this is undeniable.
Undeniable.
You had a biopsy and you were sent home.
Right.
No surgery.
No.
And you had another seizure?
Had another seizure about a week later.
That's a long wait, a week to be like, did they give you a plan of action? Did you even know what it was?
There wasn't much plan of action. They wanted to wait for that biopsy to come back.
I mean, that could be one of the longest waits ever.
It was.
Just in general.
Because
Having to have something biopsied. I mean, the brain is obviously different than like a bone, right? So.
Because if you go way back to 2005, I had lymphoma.
Oh, I did forget to talk about that. Yeah.
And so the question was, is it a lymphoma that popped up, or is it a spread from tongue, or is it new?
Like a third cancer.
So that was a big question before a plan of action.
Right. Okay, so then you get the biopsy, you get it back, and then the next step is what?
Sit and wait. And they're like, yep, this is what happens. But hadn't quite gotten to the plan of action yet. Had another seizure and ended up back in the hospital, of course, and was transferred back to Ohio State.
Okay.
So this was local, and then transferred to OSU.
Got it. You eventually had that treated.
Mm-hmm.
What was that like? Knowing that there's treatment going on in your brain.
So what they did, I was part of a clinical trial, and it's so randomized. The normal protocol would be to treat someone with surgery first and then radiation. But the clinical trial was to do randomized radiation, and then the same day do surgery. So that's what we did.
Incredible. That worked.
It worked.
You've had some ups and downs along the way. You've had some infections, which were very problematic, at sometimes maybe even more problematic than thinking about having a cancer cell in a certain place. Where exactly did you have these infections show up?
So I had infection from probably, and I don't know, you can probably answer this better than I could, but maybe from suppressing my immune system with Erbitux. Not the easiest path, but overall effective.
Where in your body? You've had multiple times. You've had, well, if I recall, you had infection in your brain. Am I wrong?
No, I don't think so.
So just lung
Lungs, yeah.
and not here.
My jaw.
Yeah. Okay, and then you had your jaw became infected, and that was pretty serious. Serious, where you were having multiple rounds of antibiotics at home. When was the jaw infection?
And I think that may have been underlying for a while, but undetected.
Right, and then it manifested when you had immunosuppression.
Right.
And then I remember going through that with you, if you will, but as your physician, and one at a distance at that, and watching you take it like a woman and be like, we're just going to do this. Yeah. This is what is being presented to me, and it's just what I have to do now. And you didn't back down. You weren't shameful. You weren't woe is me. You were just like plowing through. It is really courageous.
Yeah, thanks.
But then you had infection in your lung. I mean, there was some ongoing for a while. And I remember you were sickly, infections are tough on the body. I mean, these are other things that are not you growing in your body. Right. Cancer philosophically is interesting because it arises from within you. It is you. It's something that you're trying to kill off little parts of the body without killing off the whole. It's one of the very interesting things about cancer is trying to eliminate part of the body biochemically, radiologically, surgically. Obviously, we can take a toe off and you eliminate part of the body, but a part of the body that isn't welcome there because the goal then of that cancer is to kill the whole self, right? And philosophy aside, here now you have other things growing in you that aren't you. And so I just think philosophically it's interesting, but it wasn't that easy to get through.
No, and we're still cleaning up the aftermath of all of that.
Yeah.
But in a much better, healthier spot.
Remind me where they thought the infection in the jaw came from or why it was there.
So and I may or may not say this correctly, but the amount of radiation that I had, I probably had infected. It became infected.
I think it became a suitable place to harbor bacteria that maybe resided in your mouth or on your skin or somehow got there. And they're not supposed to be in your bone.
Right.
Yep. And then they did because the bone sort of opened up and there was channels in there. And all of a sudden that they could colonize. And then they did. And you've had treatments for your bone. Yeah, to stabilize. What is your current treatment right now?
So I follow with you and this is our protocol. And that's it.
Yeah, you are not on any chemotherapies. You are outside, and we have run recently we ran like a circulating tumor DNA test. Yeah. So we're looking really as microscopically as we can as physicians and as patients working together to say, like, is there a cancer signal detected in the body? And when we get that, no. In fact, I think you saw the lab before I saw the lab, and we're like, knock, knock, by the way, you want to check that lab out?
Right.
And I was like, oh my God. And just your attitude about it is, for me, is refreshing as a physician, and to be able to obviously sit with you here and,
Thanks.
and see the success and be able to have you be so brave to share your story with others, because so many people have a way easier time. Some people have harder times. I think it was a difficult course because of how many different interludes you had with hospitalizations, or there's cancer, but there again, that we can see it, or now I have to go through this or this procedure, or how many years you were going into the medical oncology office, how many scans you've trudged through, all the while deciding, like, okay, I just waiting to get to the end of it. I'm living, But a lot of people may have less cancer, less times, but may end up succumbing to the disease and a lot of it's attitude. And
We hear a lot of people say attitude is everything. And it is, but at the same time, you have to surround yourself with the right people, the right treatment, and the right thing.
the right treatment, the right people, and the right
Thing.
thing.
Like the thing that you love, that you enjoy.
So
yourself.
it's not reading books.
No,
It's
not.
maybe tennis. It's your new husband, who have
Definitely.
had the pleasure of meeting. What besides the right people and the right attitude do you surround yourself with?
The right environment.
Yeah, which is like a biohack environment? Are you going to Pilates? Tell us about your environment.
So my environment, I have to explain that. I live in the Mid-Ohio Valley.
That's the game again. With the what valley?
At Mid-Ohio Valley.
I got that.
And my speech therapist would say, one word at a time.
Yeah.
So I live in what we call Cancer Valley.
Yeah. Thank you for bringing that up.
And if you've seen the movie Dark Water,
Well, I've seen it twice, and I'm in the middle of it for a third time now. One of my favorites, and yes, we've talked about this.
yes,
Yes, this was PFAS. This was the original DuPont and the PFAS. They were bearing millions of tons of this and spilling it into the river.
right.
Yeah.
So I didn't have the typical cancer driver that you think about with alcoholism, HPV, Epstein-Barr, or EGFR mutation.
Yeah.
So it narrows it down to environmental.
Okay, so PFAS is an issue. We're testing your PFAS, but you also tested positive for some other pretty interesting
Heavy metal, yeah.
heavy metals. Yeah, tell us about the metals that we've tested.
So we did total tox, and that was right at the time I had that brain tumor, and it came back for some odd heavy metal.
Yes. And then you worked with one of our favorite colleagues, helped clean you up. You were working on mold. You were working on total tox. This is we're going to give a shout out. Should we? Should we give a
For
shout
sure.
out? Dr. Jessica Tran. Yes. Go Dr. Tran. It's been nice to be able to partner with colleagues and to know where there's expertise. I mean, I understand environmental medicine, but I'm not an expert in environmental medicine. We'll keep working on PFAS with you. Take a look. There is several instances where we see PFAS in somebody's blood. We check blood. We do not check urine. We want to see what's in the blood. And because remember, if you're checking urine, that's just what came out of somebody. And we don't know if somebody's an efficient or not an efficient detoxer. So that's why it's important to test blood. But then when tumors are removed or when the tumors go away, we actually see PFAS levels go down. So anything else?
That's about it.
It's a lot.
That's a lot.
Are you living your best life now?
Absolutely.
Wow. I love that. Well, we have something for you for being on Olivia. You got that thingamajigger? So, gracias. Right here and around my neck, I always show, these are EMF diffraction devices, Aries. We probably talked about it, but our clinic is an EMF safe zone certified by Aries, ariestech.com. And we appreciate these devices so much. We keep them center stage to keep us safe. And then they've given us these gifts. This is what's called the LifeTune one. This is for your
that's
phone.
awesome.
I keep one of these on my phone. I keep one on my computer. I keep one around my neck. I mean, yes. And that's an important part.
I appreciate
So,
that.
I mean, you really and truly are really just an example of, well, cancer, resilience, and being human. The resilience and the moving through and the survival instinct and the happiness and the fact that you can come through that. And the fact, like this is a fact, not opinion, and live to your best life. You had, in order to get to where you are, you had to go through that.
I had to.
Yeah. And then to be here and share this with us and all the audience, you have my really deep appreciation and gratitude and thanks.
Thanks. Well, I appreciate your help.
Doing my job. For Rubin On Point, what can I say? If you've gotten to this point, then the episode speaks for itself. I just want to say thank you for joining us. Thank you for joining us on Rubin On Point, a podcast about cancer, resilience, and most of all, about being human. I hope today's conversation inspired you to see new possibilities for growth, healing, and strength in your life. If you enjoyed this episode, be sure to subscribe, leave a review, and share it with someone who could use a little extra resilience in their day. Remember, no matter what challenges you're facing, resilience isn't just about bouncing back. It's about building a life of purpose, connection, and vitality. Until next time, stay strong, stay healthy, and take care of yourself and those around you.